everybody, Dr. Rogers and Oscar here. This is week 2 of his chemotherapy for his lymphoma. So I want to talk about all of the things that happened this week. So I feel like this week has been kind of a 2 steps forward, 1 step back for Oscar. So if you look at his face, and if you guys remember last time, he was really swollen through here. His face was really edematous. He had a ton of fluid and edema here. So that all went away about 2 days after his chemo. But you can see really closely, he's also developed something called facial paralysis. And this actually was developed yesterday. So if you look here, see how I blink, see how he closes his eye completely. See here, see how he's not doing that? None of this is moving. He does pull that third eyelid up, but he actually can't blink here. And if you look, hold on bud, if you look really closely, this side of his face is actually drooped. So that happens sometimes in older patients. I assume that this is part of his lymphoma protocol. We've just been having some bad luck. So he's drooling more on this side and he's dropping some food. Not a big deal. We just have to lubricate this eye multiple times a day with some eye lubricant so it doesn't get dry. So that's, he doesn't feel badly for that. He just literally cannot move that side of his face right now. So we've got that, and then also he developed some swelling and ended up licking a hot spot here on his leg, which is resolving. So we're spraying this at home, and actually I took a tube sock and made him a little bit of a sock to prevent him from licking that. So there's our 2 steps. You know, we had much better. He's been feeling good, he's breathing well, but just full disclosure, that's what we've had happen. So I'm really pleased that we started his chemo when we did, because I'll be honest, as quickly as he was progressing, we probably wouldn't be with us had we not started treatment when we did. So this week's chemotherapy is actually a pill, and many times we don't think about chemo as a pill. So he's going to get, Oscar, are you hungry? You are hungry? So this is something called cyclophosphamide. So this is a pill. So anytime you handle chemotherapy drugs, you need to make sure you're using gloves. This is a drug that we have to worry about being excreted in his urine. So he's also going to get a diuretic with it today. And our team is going to take him out every hour here for at least the rest of the day, because what can happen is this can cause some inflammation inside his bladder. So it's really important that we're getting him to urinate and get all of this out. So this is probably the easiest chemo treatment ever. It's going to be some pills. You want a snack? You do? Okay. You can see he's kind of chewing a little bit weirdly because, again, he can't feel that side of his face. And then this is our chemo. So we're going to put it in a little meatball. Did you get the other stuff down, bud? So I know you're very excited about this, okay? And then we're going to follow it up with some more just to make sure he takes it down okay. There's our chemo treatment for this week. So we have already checked his blood cell count. So his white blood cell count is adequate. We need more cookies for where we want it to be. We're going to watch him really closely. He's got to go outside to potty and all of that fun stuff. And then we'll check him again next week. And if everything looks well, his white counts are good, we'll give him another injectable protocol. So week 2, chemotherapy for Oscar. 2 steps forward, 1 step back, but we're handling it. Okay, dude? Yep, and there's the drool.